Transportation Authority, and also Madame Han Jinyan from local CDC to brief you the latest information regarding deep disease prevention and control, and also answer some of your questions. First, I give the floor to Madame Han to give you the updated disease prevention and control situation and also the epidemiological investigation. Friends from the media, the local infection caused by the Omicron is undergoing, and we have taken the strict measures to contain the spread of the virus. First, let me give you a bigger picture. As of 12 p.m. today, 97 confirmed cases reported, 49 locally transmitted cases, 15 asymptomatic cases, and the rest 33 cases with positive PCR results, and we will verify it further regarding their clinical symptoms. So among the cases, 90 cases in the Jinnan District. For the epidemiological investigation still undergoing, so for the complete report of that 80 patients, we have some conclusion. For the elderly people, 74 years old, a younger one, 5 years old. And the first case we found on December 9th. And from January 6th, we have seen an increasing number of infected cases. Right now, we have found 6 family cases. Linjin Garden, Xianshuigu, Zhonghuili, is compounds. And also in our mass testing, we found 3 cases. And for the rest of cases, actually, they are the close contacts. And the people working on the front line in restricted or the lockdown areas. For the vaccination, among all the confirmed cases, only 1 children have been vaccinated. 3 cases just finished 1 shot. And for 76 cases, all finished the fully vaccination. And also 20 cases of patients, they also had a booster. For the features of this round of the infection, majority cases in university campus, and also the families and people participated in a funeral. So there's right now the key areas are identified. We haven't known yet whether this Omicron came from. What we found is from the community level. So far, based on the infected cases, we have seen a very clear logic. They're all related to Jinnan District. And second, regarding the mass investigation, the mass tests. For the first round, we started from the 7th of January. So far, we have finished more than 11 million, and 7 million already showed the results, with 77 positive to the virus. So the 70 cases actually from these mass testing.
下面和大家说说我们整个根据疫情形势的发展，我们动态调整社区管控范围。那么具体的情况是这样的啊，自2022年1月11日18时起
，From January 11, 6 p.m. 临锦、咸水、丰达 This community, a high-risk area, 新域、一家、龙湖子城、众惠里、同泽里、同泽园 the medium-level risk area.
我们的这个管控区、风控区还有防范区的划定是这样啊。京南区划定
Jinnan District
新域景苑除1号楼，上月花园除15号楼，碧水世纪园除45号楼，碧水四季园除46号楼，林锦花园除2、4、10、15、16、17、19、21、23、24、26号楼，林秀花园除59号楼，新域花园除6、10、13、19号楼，新亭花园
新亭、
一家花园除2号楼，
一家、
新阳园除10号楼，
新阳、
众惠里小区除5号楼，
众惠
兆和
里、
园除6号楼，同泽园除
同
12
泽、兆惠
丰
里、
达园除1、10、26、33、38、40、41号楼，龙湖子城
丰达园、
37、38号楼，
龙湖子城、
除金泽园温泉洗浴中心，双港镇新桃园、
金泽园、双港、
桃园除2号楼，仁永民居除6号楼，还有北闸口镇上里园除31号楼为封控区。那么京南区以海河
And these are the restricted area.
含联络线、唐京高速、双桥河维和区域封控区除外为管控区。
And we also have the further identified controlled area.
这样划定的，这是京南区。那么西青区呢，我们划
So
定
that's in Jinnan District
和大寺镇全域为管控区。
and
河西区
Wenke Village.
是将
So the controlled area, Jinnan District,
4号楼、友谊路街、柳江路、
友谊 District,
恒盛大厦1号楼为封控区。
the
尖山街
restricted
瑞江花园
area,
竹苑及沿街底商，友谊路街、柳江路清泉大众洗浴、舒安烟酒店、东方富豪大酒店，天津唯物为主餐饮服务有限公司为管控区。尖山街瑞江花园及周边底商，以及友谊路街、
Ruijang Community and the compound.
封控区和管控区除外为防范区。这是这样的一个我们相应的一些区域的划定。
Restricted
像我们
area.
广大的涉疫地区人民群众要严格
For
落
the
实
people
我市
in the
疫情
controlled
防
and
控
restricted
政策
areas, please
封控区
practice
严格实
the
行
disease prevention control measures. And within all these areas,
服务
we
上
not encourage people to go outside, and we also provide the daily necessities door to door, and also the health code were not turned right.
人不出区，严
And
禁
for the restricted area, we also not encourage public gathering, and people stay at
原
home.
则上
And the
每户
health
每
code
2
is
至3天
orange.
可批准
And
地
for
在
each
严格
household,
做好个人
the
防护的前提
every
下
2 to 3
到社区
days,
指定地点购
one
买生活用
family
品
member
所有
allowed to go
出入
outside
人
to
员
the
落
designated
实查证
places
验码
to
测
buy
登记
daily necessary,
管
and
控
their
区内
temperature
发
should be
现核酸
measured,
检测
and
阳
their
性
health condition should be
立即
checked, and
管控
also
区
their information should be
在此
registered.
也提醒广大人民
And
群
if
众
we found
针对
any
近期可能具有
cases
封
in
控
the
区、管控区冷居
controlled
室
area,
及
and
新
these
冠
area
病毒
will
感染
also
管控区
identified
重合
to
的人
the
员
restricted area.
鉴于存在一
And
定
for
感染风险
anyone,
市疫情防控指挥部将推送提醒短信。为了
if
迎合
you
家人
have
健
the
康与
similar
社会安全，
the travel history of the confirmed cases, we will also, if he text you about the travel history of confirmed cases, and if you found you have the similar history, please report to us, and also please stay at home, and also put a close eye on your health condition.
严禁前往公共场所或乘
And
坐
we not
公共交
encourage
通
you
工具
to take public transportation and go to public areas. If you show any symptoms such as a fever or coughing,
要及时就诊，
and please go to the fever clinic and also report to the doctor regarding your travel history. Thank you.
下面请刘道刚先生介绍
I'll give the floor to Mr. Liu to brief you
相关防控工作。
the measures taken by the Transportation Department. Friends from the media, and the residents in Tianjin. Since the outbreak of this round of infection,
交通运输系统的广大党员干部立刻行动起来，压实责任。
we have taken immediate action
我们
to practice disease and prevention and control.
这场特殊的战争，在我们整个的工作措施当中，
And regarding our measures,
来
we have
压实各方的
put
责
in
任，
place
来管控好我们的重要通道。首先，
as followed.
从
First,
公路方面来看，请各位媒体朋友
regarding the
关注
road transportation, let me show
这是
you
我
a
们在
map.
全市高速公路
This is the expressway and the
270
road in Tianjin. So far, we have set up 279
交通、公安、属地政府
checking
以
place.
及运营
So
公司
the Public Security Department, the Transportation Service agencies all help us to check
是对
at each checking point.
查验
For people going
48小时内核酸为阴性的
outside Tianjin, you should hold a 48-hour valid PCR and also at a letters from
这是我
your
们
company
279个
stating the reasons for departing Tianjin. At the same time,
京滨高速作为连接
Jinnan
京
Expressway
城和滨城双城之间的重要通道，及时切断了通过京滨高速
is connecting the neighboring
连接其他
cities.
通道离京的，
Right now, we put a temporary
既保证
suspension
了京城、滨城之间通勤的便利化，同时呢，也有效地预防了我们的疫情外溢的风险。
make sure that the
在铁路方
no
面，
the risk of spreading the virus to other cities.
3个方面，
For railway, we focus on three things. First,
强化了离京管控。从
we
1月9号24
strictly
开始，
tighten
对所有的通过铁
the
路
people living Tianjin by
都
rail.
要查验2
For
证，
all the passengers, we
也就是
require them to hold
48小时内
2 codes and 1 certificate, which means 48 hours valid PCR negative test results, and also the
以及
certificates and letters from the company and local community, and also your health
来
code.
京的管理。对
At the
所有
same time, we also
到达
put a
天津
close eye on the passengers arriving
到达天津
Tianjin by rail
要
or
查
by
验
road.
48小时内
So the 48 hours valid negative PCR test results should be checked, and also
对在
their
测温
temperature
当
should be
中
measured.
发现体温异常的旅客，
If we found
第一时间
anyone with abnormal temperature, will be transported to local CDC.
第3个方面，我们就是强化
Third,
场站的管理和服务，
we also focus on the service provided at the stations.
是防止的要求。铁路的场站
For the railway stations,
设施和空间的消杀的力度和密度，
we also
天津市的
double our
市内的
effort
各个场站
to conduct
严格执行
disinfectant
每2个
work.
小时
So which means every 2 hours
公共
for
卫生间
the
的
waiting hall, for the public
对
toilets,
安检仪
we will have a round of cleaning work.
卫生间等
For
重
the
点部
chairs,
位进行适当
for the handles, and also for the other key public areas, we'll
货
also
车车辆
have the
动
quite
车入库后进行全
the
面
frequent cleaning work, and also for the
这是
transportation
我们
means
整个的铁路方面
also will go through a
做
thoughtful
的整个的
disinfection
管理
work.
和管理
So this is what we are doing right now to the railway transportation.
铁路部门的部分场站通过停售、停运的方式，对进京的车辆我们进行了管控。
And we also control the transport of
从
the
1月11
trains
号，也就是今天
available to
今天的零
Tianjin.
点开始，
So 12 a.m. today
凡是在场站和12306订票
for the
乘车在
passengers
天津区域内各个车站的
who bought tickets in the station or by 12306.
即时办理，
If your train cancelled, you can get
不收取
a refund
第三个板
with
块
a full
是
amount.
航空运输。
And
目前我
regarding
们天津
transportation
滨海
by
国际
air,
机场从1月10号开始，
the Binhai International Airport from
通过机场离开
January
天津
10th,
查验两证一码。
you also need to have valid 48 hours PCR negative test result and also the health code and also the letters from your company and a local community.
同时还执行严格的测温。
And also temperature should be checked.
而我们的天津航空等航司对于
And for the aviation department,
进出天津国际机场的旅客，
for
给
the
予
passengers
及时的退票和
in
补
and
签
out Tianjin,
也不收取任何的。
if their flight was cancelled, they also get full
我们
amount
的第四个板
refund.
块就是我们的轨道运输。
Fourth,
轨道交通集团根据疫情防控的要求，
regarding the
及时做出了相应的调整。
subway service,
首先，对我们的运营区间陆续根据政策的变化进行了调整。到目前为止，地铁1号线
for the subway number 1,
是刘园
the
站到财经大学站，双林站到东沽路站，
also made the
所有的这个区间的
changes
双林站
according to the dynamic change in disease prevention and controls
地铁6号线2期
for the
从陆子道
subway
站
number
到
6.
咸水沟西站。那么这个区间的所有场站实行临时的关闭。
Also have some stations
其次
no stop.
是从运营的时段上，我们进行
Regarding service hours,
根据我们客流的变化和疫情防控的
based
要求，
on the traffic
轨道集团对我们整个的各线网
and disease prevention requirement.
我们的
For
运营
the
时间
peak time,
调整为
the
到8
interval
平
between
峰时段
the
调整到
subways
7到10分。
is 5 to 8 minutes.
在第
And
三个
for
方
the
面，
off-peak time, that will be
我们整个
7
的
to 10
线网
minutes.
各个运营场站在严格落实7个100%消杀、测温、验码等我们这些防控要求的同时，重点
All the disease prevention and
查验
control
监督
measures are strictly
在
implemented,
地铁的场站以及
and
车厢
also the subway
规范
passengers
佩戴口罩，
also need to wear mask
组织我们的
in a
场站
correct
工作人员
manner, and also the subway staff
上车，并且在场站内巡查，对于
also
不规范佩戴
check
口罩的现象。
the passengers on a regular basis
第5个板块就是我们
to
的
ask
道路
the
运输
passengers to wear mask in a correct manner.
我们的公交线网根据
Regarding
疫
the
情防控
bus service,
目
we
前我们
also
调整
modified
线
and adjust
达到
the
280
bus service. So far, 288 routes
停运150
have modified. 159 routes right now is temporarily suspended.
采取区间运行的方式
188 routes right now is under
另外一个我们改道路
further
16
modified, and 16 routes so changed their
我们的
normal
线路
bus service
调整
route.
可能给广大市民的出行带来了不便，
This may cause some inconvenience
但是这
to
也是我们的
residents in Tianjin, but this is just temporary requirement to deal with the disease
第二
prevention
个方面
diseases.
就是我们的道路客运。目前从天津出发的
Regarding the coaches
到达北京以及其他省市
from Tianjin to Beijing and to other cities, so far 123 intercity routes all suspended.
和我们
For
驾
the
驶员的
chartered
咨询等业务
coaches
全部暂停。
and also temporarily
第
stopped.
三个呢，就是我们的出租，
Regarding
我们已
taxi
经
service,
做出了明确的规定，
we have a
出租企业和
clear
出租车驾驶员不得进入
requirements. The tax companies and the taxi
管
drivers
控区
are not allowed to enter to the restricted or controlled
并且我们
areas.
这个范围会根据市防指的
And also the scope of these restricted and controlled areas also
与此
change
同时
dynamically.
我们还要加大对乘客和出租车驾驶员
For the passengers and taxi drivers should all wear mask correctly, and the health code should be checked, and also the scanned the health code, and also for the taxis also need to be cleaned in a regular manner, and also should practice ventilation. So all in all, make sure that all measures in place should be practiced to letters. Here, I also would like to make it clear. For transportation services, we're now all involved. I believe with everyone's support, we will for sure do a good job in disease containment. And also, I would like to call on the residents in Tianjin, and please be cooperative, and please not conduct mass gathering, and also please not leave Tianjin if not necessary. Thank you. And I'll give the floor to Academician Zhang to introduce how TCM play its role in dealing with Omicron, and also the treatment to the younger ones. Friends from the media, I know everyone pay a close attention to this round of infections triggered by Omicron. This is another round of fight. In other countries, we have seen a big explosion of the Omicron cases. We have seen a sharp curve. And at this time, we are so close to see the transmissibility of this variant. Compared to Delta, and also compared to the virus very early we found in Wuhan, and this time this is more contagious or more easily to be transmitted. This is at least we call it a third generation of variant. And we talk about the symptoms as quite mild. So it's not really show strong symptoms, so people not really think they actually infected. So during the mass testing, we found that the confirmed cases, because people not really feel anything, especially the confirmed cases. And also we found one student actually transmitted that virus to the classmates. So it's 1 to 10 people to more than 10 people. So this is really a strong transmissibility as the feature of Omicron, and also with mild symptoms. So we can see that the 30% of the confirmed cases is asymptomatic, and also the 50% of the cases is mild symptom. So we not really found that the quite severe cases, same to the younger ones, the younger patients, and also the elderly patients. And regarding the patients from other countries arrived in Tianjin, and also my team right now provide the treatment to 50 to 60 patients. And also based on our studies of the variants in Africa, we found actually the logic word is quite the same in different places. For asymptomatic cases, at the very beginning it shows no symptom. After 2 to 3 days, it shows some symptom, but all in all, the all mild condition. It's just found a coughing or sore throat. And some patients showed a fever. So that's around 38 or 38.5 degree. So a lot of the symptoms at the upper respiratory tract. For at the very beginning for the COVID-19, people feel it's really hard to breathe. But this time, we found that they're just coughing. And also this time, we found that the people not really have some strong symptoms in their digestive tract. So we can see this is some of the new features caused by Omicron. This time we found that actually it's not really show very strong a damp toxin. So this time we found that the symptoms just like a normal a cold or influenza. So after 2 or 3 days, the symptom developed as a coughing with long hit. And to the later stage of the disease, people found that the fatigue or feel very easily to feel tired. So compared to Delta or to the Alpha, we could see that there are some similarity, but also some differences. A very strong transmissibility, but the symptom is quite mild. For TCM to work, to treat Omicron, we believe TCM can play an even bigger role. So this is based on our previous experience, especially our experience accumulated in overseas countries. So it can really cure the symptoms, especially the coughing, the sore throat, and fever. And also the cases very soon turn to negative to the virus, and also it's really rare to turn positive again. And also the really rare cases showed the severe symptoms. I believe that we have seen a more prominent advantages brought by TCM. Delta, we found that really high fever, and believe that also something related to the high temperature because it was summertime. But this time we found that people not really show high fever. Also not a lot of people with fever. So we also changed our treatment. So at the very beginning, we first deal with the coughing. And also at the second stage, we dealt with the preventing plaque from forming and stopping coughing, and to clean the lung, and also have a new medicine that a new prescription for the close contacts. And for the normal public, we suggest that people use a medicine that we already had applied to the population last year, and we showed very good results and received really good feedback. And you can actually get the prescription in the hospital within the coverage of health insurance. And for the patients showed cold due to wind cold or wind chill, we also have another prescription for this group of people. And liquid containment also available for the people that's wind heat type common cold. So for wind chill type or wind heat type common cold, we have different TCM prescription available. For the children, at the very beginning, we have seen more cases. Right now, we have seen the more adults infected. It's at the very beginning because we found a case in a daycare center. So that is why at the very beginning we've seen quite a lot of cases actually is in a younger generation. But right now we have seen increasing number of cases among adults. And yesterday we also had a meeting. And that's the consultation of doctors. We also invited 3 doctors from Western medicine, and we work together. And so far, we have seen a quite good results among the younger patients, and half of them with no symptoms shown. And for the kids with symptoms, just coughing, or the not feeling good in their throat. And we try everything we can to treat the kids as soon as possible so the parents can rest assured, and the same for the public. So we should give a further good care to the young patients. Thank you. The floor is open for questions. CMG. My question to Academician Zhang Boli. So what's the difference of Omicron compared to previous variants? And is there any TCM available that we can help to give to our kids so they can have a stronger immune system? As I introduced, so the 32 variant points of Omicron. So that's all including the variant points of Delta. And we can see that looking at the confirmed cases, the patients already finished their 2 jabs of vaccines or even have the boosters, but still infected. So we could see that the Omicron actually also can run away from the vaccines. But still, we ask the people to first vaccinate it because vaccines still work. They may not be strong, but still works. For the Omicron, although it shows mild symptoms, so people just say it's just normal cold, no big deal, but that's so wrong. And we actually put a very close eye on development of the COVID-19. And we also have a quite close communication with our colleagues overseas regarding the sequelae, because right now we have seen 30 to 50% of the cured patients show different level of sequelae. So this is the number we got from overseas countries. For the sequelae, the symptoms we found in China, the majority cases is like fatigue or palpitation. But we still need to put more efforts to understand the causes of all these sequelae.
儿科的治疗呢，上午我们就讨论时候就定了，即使现在没有症状。
So we also talked to the pediatric department, although right now some kids not show symptoms, but they show positive results to virus. Maybe 2 days after they hospitalized, they showed that the coughing. So maybe at the very beginning, from day 1, we gave them the TCM prescription. So don't wait until they show symptoms. So we can also run ahead of the curve. And also looking at the kids, they are so cooperative. They really behave themselves and also listen to the doctors and nurses. They like to take TCM. So for a precaution in the kindergarten, we not encourage kids to take medicine, and like the not conduct public gathering, wear masks, and conducting ventilation frequently, washing your hands frequently. All these practice with 2 years of proven. These are the effective ways to make us stay away from the virus. For the kids, we should pay a close attention to their digestive tract. Don't let them eat too much, because they accumulate the overheat in their stomach. And also make sure that they not really wear too many clothes. We talk about actually let your kids strong enough so their immune system can protect themselves well. So don't really let them eat too much, so they will accumulate overheat in their stomach, or wear too much, so they're not really strong enough to protect them from the cold. So we have many available and effective medicine to the kids, but we not recommend the kids with no symptoms or not infected to eat medicine. 新冠 News Agency, my question also to Academician Zhang. So what kind of a practice this time in Tianjin can be a good reference to the whole country?
也为全国提供经验。当年的武汉人民做出重大牺牲，但是给全国提供了很好的经验。
We talk about that at the very beginning, and the experience in Wuhan actually provide a good reference to the whole country in terms of disease prevention and control. And we talk about when one side is in trouble, help from all sides available, and also the whole country also give great support to Tianjin. I've seen that many companies right now contact right across to donate medicines. And Tianjin also has our responsibility to accumulate lessons to provide that to the whole countries. Regarding Omicron, it's very strong in terms of transmissibility. We hope that they just let the curb it within Tianjin. But we also need to prepare ourselves for the worst scenario. We need to provide a Tianjin solution in curbing the spread of the virus. We found the case on 8th of January, identified as Omicron, and on 9th and 10th of January, in 2 days, we conducted mass testing for a city of 10 million population. This is a really arduous work. So that my neighbor received a text message and has the appointment time available for each household to take the test. We talk about that we should take really swift action, because just within 3 to 5 days that we will find the first generation, even second generation of infected cases. And also people should practice the strict disease prevention control measures. So we talk about stay at home, then just don't go outside. So people should be cooperative. We talk about the controlled areas, the restricted areas, should have quite clearly identification, and also we should keep in mind and what kind of the measures we need to take, and also we need to take our actions in a precise manner. So we're also looking at the mass testing, the treatment available in a hospital, daily necessity delivery, is all considered. And yesterday, we also received a letter, really warm and sweet letter from the local Tianjin government. I believe that with our concerted efforts, this experience we learned from other cities, and also by putting into the additional solution from Tianjin, hope that also can make our contribution to other cities. And today, the National Traditional Chinese Medicine Administration right now also had a virtual conference regarding the prescriptions against Omicron. And the meeting is still going on. And my team had quite a first-hand experience in treating Omicron-related patients. So I hope that we can have a set of solutions with TCM solutions. So that I hope that solutions can treat the patients in Tianjin, and also that the wisdom can roll out in other cities. Of course, we don't want the other cities found the Omicron-infected cases, but at least we have some solutions plans in place for otherwise. And I hope that can mitigate impact to our people's day-to-day life, to the normal production order. I hope Tianjin can do more things in this regard. Thank you. Madam Han, we found the 2 infected cases found in Henan on 10th of January related to the cases in Tianjin. So it's the university students, as in the media coverage, I would like to further identify the identity of these Henan cases. I believe that this news put in the public interest. On January 8th, we received the reports from Hebei with surname Zhong as the person from Tianjin to Henan with positive results to the testing. Right now, we work on the epidemiological investigation. After receiving a heads up from Henan, we look into the cases. Yes, indeed, from the one university as a fresh hand in a university. And this freshman actually, on his way back to the Henan, he showed the negative results. So we screen out the close contacts, the secondary contacts, and general contacts. We need to make sure that we can find the old close contacts out, so we can curb the further spread of the virus. So we conducted the epidemiological investigation regarding this case. For this university, for the faculty, students, outsourcing staff, totaling more than 1,000 people received their testing. So far, we have collected more than 10,000 people samples. 4,842 results negative to the virus. So this is the number available today at 12 p.m. And for the people living in the same places with the faculty or the outsourcing staff, and so far, all the available results are negative. And we also conduct investigation into the environment. We collected the environmental samples on January 9th, totaling 127. So that's from the cafeteria, from the dormitory, from the classrooms, the public toilets. It's all negative to the virus. For this university, we found a person with surname Liu, and we talk about a funeral, and this person's father participated in funeral, and the student's father is positive to test on January 9th. So the student and the mother identified as close contacts, but so far they show negative to the virus. And they will be further tested. Going forward, and we'll continue to follow a case of the surname Zhong. It's a Henan cases, and also look into the travel history and also to finish the PCR testing on the faculty, outsourcing staff and students, and wait for the final results of the testing. And we will keep you updated. So he went back home on December 28th to Henan, and on January 8th, we found the cases in Tianjin, especially on the 9th of January. We also ask people if they need to leave Tianjin, they need to have that 48 valid PCR test results, and also the letters from the company. And also we ask people not leaving Tianjin if not necessary, and so that we can curb the spread of the virus to other cities. And we know that Tianjin is so close to Beijing, as the many key events coming up. And also, once again, I call on everyone, the residents in Tianjin, if not necessary, please stay at home. My question to Mr. Liu. Right now, the virus still is raging in Tianjin, and the quite increasing needs on the transportation vehicles for transferring confirmed cases. So what's the arrangement in this regard? We have set up a specific team to shoulder responsibility in this regard. Within 24 hours, the vehicle will be dispatched to the needed place. So far, we have around 500 vehicles available to transfer the people from the restricted area to the quarantine area. And all these transfers conducted under strict standards, make sure that all the procedure of transferring can be conducted in a quite safe manner. And we always put our vehicles standby around the clock. So please rest assured that we have enough vehicle and they are on standby. My question to Madame Han. A lot of residents in different communities received a text message for the second round of PCR test. So why they need to conduct the second round? That means that we found a positive case in the first round. Yes, indeed, actually, for this round of the infections, majority of the cases in Jinnan District. For other districts, just the sporadic cases, 3 in Hexi and 3 in the Hexi and 1 in Binhai new area. For Binhai, just 1 case, and that case actually because the person is the close contact to the people participated in that funeral.
但是针对着
And also that the people in the quarantine area, when we found effective cases. But for the other 3 districts, these districts for sure will conduct a second round of testing.
我们计划刚才也问频次，我们计划这3个区要开
For these 3 districts, they at least need to go through 3 rounds of
他
testing.
们这相关3个区的核酸筛查的一个结果，还有
And based on the testing results,
整个的全
as well as the citywide testing results, we will
核酸检测的
study into the results and also make the further plan regarding the scope of testing and the frequency of testing.
我们也要做好科学精准。
So we not really just randomly conduct testing. All the tests will be conducted in a scientific and precise manner. One last question, please.
你好，我是中国青年报的记者。我的问题想问一下刘道刚主任。
News Daily. My question to Mr. Liu.
政策是怎么样的？请您给我们
So what's the policy for transportation from Tianjin to Beijing?
当前啊，按照
Thank you for your question.
坚决阻断奥密克戎变异株的扩散蔓延，刚好我们守
In order to contain the spread of the Omicron variant
这样的一个
and protect the safety of Beijing,
进京通道的管控，就成为了至关重要的一个
so it is our key responsibility to play as a guard.
公路和铁路两大通道。从
So there are 2 ways
刚
to
才向媒体
reach Beijing from Tianjin, one by
我们的第一道
road.
线是279个沿高速公路
So I show you that so far we have set up 279 checking points.
我们要查验48小时内
So the 48 hours valid negative PCR test
接诊
and letters issued by the community and the company and the household.
除了这第一道防线之外，
So these are the 3 things
也
must
就是
checked.
说，我们现在的公安检查
On top of that,
在武清区，我们的
in Wuqing District, Zhouchun Village, Huangcheng Road, Dongjian
还有
Road,
冀州区、
Jizhou District,
县、平保县，
Tongwu, Pingbao,
那么这
and
6个
Jingxi
重要的
Road.
关口
These 6 very important places
我们对标啊首都的
conduct the thorough
经过
checking
这6个公安
for
检
the
查站
vehicles passing these 6
实
points
行叫逐人核验，
because they will
48
head
小
into
时内
Beijing. So for each person, they need to have a valid 48 hours PCR
还有我们的
results and the household from Beijing, and the matter should be checked.
疫情防控，
So we will conduct the identical
确保从公路上
practice
把我们的进京通道。
as Beijing.
第二呢，就是我们的铁路，
And another mean reaching Beijing is by
17个铁路的场站。
rail.
应该说，铁路的我们这种通车的密度在全国也是最高的。如何做好铁路环节的进京通道管控工作，非常重要。在这个环节上，我们实行了叫5个100%。
So we right now practice 5
旅客如果
ways.
通过铁路进京的话，要过5
So
关。
if passengers want to arrive Beijing from Tianjin, they need to have 5 things available first.
要查双证，
They need to have the certificates available, which means the passengers need to hold 48 hours valid PCR negative test results and the letters from their community and the companies. Without that, the passengers are not allowed to enter into the station. And second,
双码严查加测。
and the
就是我们要
passengers
看你的健康码，
need to have a
我
health
们
code
要看你的金盾码，同时要实行测试。
of Beijing as well as the one in
非绿
Tianjin.
色
If your house code is not in green, then also not allowed to enter
那如果体温
to
上
the station.
当然更坚决不能允许。
And so if you show abnormal temperature, you're not allowed to enter into the
实
station.
名登记。 100%对
Third,
进京旅客查验北京健康码。我们的各个场站都开通了
for each station, we have a special
逐人
a passage for the passengers heading to Beijing.
非绿码。
So if the passenger was not green, Beijing has called, and also not allowed to enter to the station, and also people on board,
那么我们车上的工作人员要逐人
the staff aboard and the train will also check temperature of each and every passenger.
从过去的叫1长1元，现在叫1长3元，1个列车长3个列车员。实行
And in order to practice all these measures,
如果测
we
温
also have seen increasing staff available for each train.
不能放假。第5个关口就是要100%在车上再次查验你的健
And
康码。
also, a health code will be checked again on board.
随着整个的最新信息的推送，可能在
And
尽快
because that the situation is dynamic,
那么我们要及时
so maybe that the person, when
体温异常
that person entering to the station, the health code is still in green, but based on the updated information of the epidemiological investigation, that person's health code may change to another color when the person on board. So we will also double check the health code,
控工作做好，坚决阻断奥密克戎
make sure that Omicron variants
把我们天津的
will be
疫情
curbed.
工作做好的同时，坚决承担起首都的护城河的重任。好，我就回答到这里，谢谢。
Thank you.
好，时间关系，现
Due to the interest of the time
现在呀，各地都在非常的关心，
the end of the Q&A session,
严格的按照发布的内容，
and
搞
also
好多种形式的宣传报道。
hope
感
that
谢3位
the
发布人，感谢媒体
our the media friends can also to bring the information to
在如此紧张
the public so people can get more information, and also like to be thank you to the 3 guests, especially to Commission John. Thank you all. This is the end of the presser.